All right, guys. So a lot of you are having trouble with this nursing diagnosis assignment. So I wanted to try to help you as best as I could to do better on this, okay? A lot of you have contacted me tonight, so I want to try to help you. Let's look at this first scenario. Mr. Ford has arrived on your ward from the emergency department. He has been diagnosed as having a CVA and has suddenly become incontinent with frequent episodes overnight. He is now very drowsy, difficult to rouse, and dysphasic since the CVA. All right, so we're going to make a nursing diagnosis statement. We're not doing interventions yet or outcomes, anything like that, just the statement. So when you read this, you're not supposed to assume. You're only looking at what you have in front of you. So there's a couple of things that you can do. One of the things that you can do, and I know that some of you have, is you can look in the back of the book and find his diagnosis, which is cerebral vascular accident, or CVA. And it's right there. It's on page 978. And they give you some suggestions. Okay? So, one of them that's on here as a suggestion is ineffective cerebral tissue perfusion related to interruption of blood flow as evidenced by altered level of consciousness. Perfect diagnosis there, nursing diagnosis. Now, you are only going to be using stuff that comes out of this book. Okay? That's it. Because these are your nursing diagnoses. Like, CVA is not the nursing diagnosis. That is your medical diagnosis. Okay? So CVA is not going to be your title. So the first thing that you're going to do is you're going to find a title. So your titles can be found different ways, but this is the easiest to me, looking at the side of the book right there. Those are your titles. All of those. Okay? So what else do we know about this patient? Okay, well, we know he's had a CVA. We know he's difficult to arouse. We also know that he's having incontinence at night. Okay? So I'm going to go to incontinence because I know that incontinence is one of those things that's a nursing diagnosis. So let's see. You're going to look for incontinence and you're going to find the title. And then you're going to read the definition to make sure that your title suits that patient. So I am going to look at functional urinary incontinence. There you go. Can you see that? Right there. Functional urinary incontinence. That is defined by inability of usual continent person, so he was continent up until he had this CVA, to reach the toilet in time to avoid unintentional loss of urine. Well, he's not making it to the toilet in time because he's having incontinence at night. So, that's going to be my title. Functional urinary incontinence. Now, we got to do related to. So, you're going to look at, in your book, related factors. So, you're only going to choose related factors that are coming out of this book that apply to your patient. So, related to, and I'm going to say neuromuscular impairment because he has neuromuscular, that's his brain, CVA, neuromuscular impairment. He's got brain impairment. So, functional urinary incontinence, related to neuromuscular impairment. That's my kitty. Now, we're going to do as evidenced by. Now, you're going to look at your signs and symptoms here. And you're going to go to your defining characteristics. Okay? So, next, as evidenced by voiding prior to reaching the toilet. Is he voiding before he reaches the toilet? Yes. He's incontinent at night. So, my entire nursing diagnosis statement is functional urinary incontinence related to neuromuscular impairment as evidenced by voiding prior to reaching the toilet. Okay, so there's one of them. Then you have the option to pick others. Now, let's say that you're doing a risk for diagnosis. Those are only going to have two parts. They're going to have your title as related to. That's it. Because you can't say as evidenced by, because they don't have evidence of it yet. They're only at risk for it. Does that make sense? Okay, so let's look at a risk for one. So he's dysphagic. That's meaning he's not going to be able to swallow really well. So let's kind of look at one of the things that we could possibly use for that. I'm going to use this little thing because it's a handy little tool. So I'm going to say about something to do with like swallowing. You just kind of go through and look and see which one fits. We don't want elimination. Food and fluid. Let's look at that one. How about risk for deficient fluid volume? That's a risk. That's a possible risk because he's dysphagic. He's not going to be able to swallow well. So I'm going to go to risk for deficient fluid volume. That's page 343. So let me go to that in my book. Hold on just a second. Okay. Risk for deficient, there we go, deficient fluid volume. That is vulnerable to experiencing decreased intravascular, interstitial, and or intercellular fluid volumes, which may compromise health. Okay, so a risk factor. So we're going to say risk for deficient fluid volume. That's your title. As related to, he's not having fluid volume loss, so that's not it. Barrier to accessing fluid. Does he have a barrier to being able to access fluid? Absolutely. Absolutely. So we're going to say, because this is a risk for, we're not going to have defining characteristics. So all you're going to have is title, and then related to, and your related factors. No as evidenced by. So your risk for deficient fluid volume related to barrier to accessing fluid. There you go. There's you another nursing diagnosis. So I hope that helps a little bit. I'm going to go ahead and get off of here. I'm going to post this to Blackboard for you. I hope it helps. If y'all need anything else, don't hesitate to get in touch with me, okay? Thanks, guys. Bye.